Good day, Dr. Kanengoni and class. Today, Group 2 will be presenting on HIV and other infectious diseases in the workplace. We will be going through our learning outcomes and then questions related to the case study. Our fourth group member, Anke, will be unable to present with us today. Unforeseen circumstances such as accidents and infectious diseases affect all individuals and groups at any time and in any place. Although there are preventative measures that can be put in place, negligence of such can lead to workplace pandemics. Infections in the workplace can seriously affect the ability and productivity of involved workplace parties. Therefore, it is important to implement actions of immediate effect to minimize or prevent such. The concept of infectious diseases is generally caused by organisms such as bacteria, viruses, fungi, or parasites. These organisms live in and on the surfaces of our bodies, however, under certain conditions can potentially cause disease. Infectious diseases can either be transmitted from person to person or by insects and other animals. Other diseases can also develop from consuming water or food that has been contaminated. Signs and symptoms may vary depending on infection, as some illnesses are more life-threatening than others. The most common and deadly types of infections include bacterial, such as TB and pneumonia, viral, such as HIV, influenza and Ebola, fungal, such as athlete's foot and ringworm, and prion, such as mad cow disease. One of the most common infectious diseases in the workplace would be HIV and AIDS. HIV stands for human immunodeficiency virus, which harms your immune system by destroying white blood cells, which interferes with your body's ability to fight infection, which enables the risk of other serious diseases and illnesses. This infection can be transmitted through sexual intercourse, infected blood, or from mother to child during pregnancy, childbirth, or breastfeeding. There is no cure for HIV and AIDS, but medication can dramatically slow the progress of the disease and have shown to reduce deaths in many developed nations. AIDS stands for Acquired Immunodeficiency Syndrome, which is a chronic, potentially life-threatening condition caused by HIV. It is contracted during the final stage of infection with HIV. However, not everyone with HIV develops AIDS. Since HIV-infected individuals are more susceptible to pick up other infections, it is important to mention the recent outbreak of coronavirus, also known as COVID-19, hence why we are presenting in a video format today. It is a new virus that started in China. It is spread through person to person and can be tested by means of a laboratory test. Symptoms of the coronavirus are coughing, fever, and shortness of breath. There is currently no vaccine for coronavirus, yet certain precautions to try and eliminate or prevent the spread of coronavirus, such as frequent washing of hands, coughing into your elbow, or staying home when you're sick. Caitlin will now address various attitudes towards different diseases.
Thank you, Megan. Fellow employees within an organization have differing attitudes towards various diseases depending on the risk factor involved. A study was conducted to assess the knowledge and attitudes towards TB among healthcare workers. Results showed that attitudes towards TB depended on the knowledge and training that each worker had on such infectious diseases. Those who had not received training on TB had poor knowledge and attitudes compared to those who had received training. In terms of HIV/AIDS, it is apparent that cultural norms affect individuals' perceptions of HIV/AIDS, for example, causing them to be reluctant when it comes to working with a fellow colleague who has HIV/AIDS. A high level of stigmatization was found when it came to dealing with employees who are HIV positive. Those who are HIV positive were more accepting of other people with HIV/AIDS in the workplace than those who had not contracted the disease. Those who had not contracted the disease showed fear of contracting it, should they come into contact with a fellow employee who has AIDS, as well as poverty and lack of empathy for those who are HIV positive. In a study conducted, it was found that just over 40% of people strongly agreed that they would be willing to work with a co-worker who has HIV/AIDS, while 37.2% of people agreed that they would be willing to use the same bathroom as a co-worker who is HIV positive. 27.8% of people said they would not be willing to share utensils with a co-worker who is HIV positive. Overall, 54.1% of people have a negative attitude towards co-workers with HIV/AIDS in the workplace. I will now hand over to Caela, who will speak about her part as well as Anke's part on top management's responsibility in the management of AIDS and other infectious diseases.
Okay. Thank you, Caitlin. The reason why individuals have certain perceptions and attitudes towards HIV/AIDS is owing to the fact that they do not have accurate knowledge about the disease. Therefore, management needs to take various steps and put procedures in place to accommodate all employees in the organization, especially those who are infected. Number 1, make sure that the employee feels heard. Facilitate care and support with them. Organizations should provide support for the employees who are HIV positive by providing death and disability benefits, in-house HIV/AIDS management programs, and emotional support for the employees, as well as emotional support for the family and fellow colleagues of the infected employee. Number 2, management should ensure that they do not treat employees with HIV/AIDS any differently to that of other employees with a serious illness or condition with regards to employment, promotion, demotion, medical benefits, or changes to their work duties and conditions, as well as dismissal. Employees should be provided with equal employment opportunities, as well as allowing them to remain in the organization for as long as they wish. Number 3, in giving the employee the support that they may require, ensure that the care and support does not draw further attention to the employee with HIV/AIDS or another infectious disease, as this can lead to resentment, judgment, discrimination, or abuse from their co-workers. In order for the employee to feel accepted at work, the organization needs to remove the stigma around HIV/AIDS, and this can be done by raising awareness and educating the organization and its members about HIV/AIDS and other infectious diseases, because most of the time people have a false idea of HIV/AIDS and what it is all about. Number 4, one of the most crucial guidelines is that you always make sure to keep every employee's health status confidential. They should also respect the employee's right to privacy and confidentiality. This means that they should not disclose this information if the employee does not wish them to. Policies and procedures should be put into place that are aligned with an actionable plan that considers employees' privacy issues of the infected employee. It is also critical that the HIV-positive employee or the employee with another infectious disease permission is granted prior to any new person becoming involved in the matters. And lastly, still make sure to hold HIV-positive employees as well as employees with other infectious diseases accountable for their assigned work duties. Do not lower your professional expectations due to the employee being HIV positive or bearing another infectious disease. Providing care and support does not mean having to employ unproductive staff. This strategy will also assist the employee in feeling as though they are being treated equally and fairly. What the organization could do to treat an employee who is HIV positive in an equal manner, just as they were to treat the employee as if they did not have HIV. During a potential outbreak of infectious diseases, it is important for the HR department to assist other functional departments in equipping them with cross-functional training to deal with temporary roles that are lost. It is essential that the HR department has actions to implement within the stages of HIV/AIDS and other infectious diseases in order to reduce potential risks. I will now hand over to Megan to speak about our chosen case study.
The case study that we chose to focus on was the Hoffman versus SAA 2001 case. This case is concerned with pre-employment tests that were studied within the realms of the Constitutional Court. The decision of whether South African Airways was justified in stating HIV testing in their employment policy was the question to the court. In summary, the case involved pre-employment medical testing and medical examinations which included the findings of the applicant, who was clinically fit and suitable for employment, however, was found to be HIV positive. SAA informed the appellant that he would not be employed as a result of these blood tests. SAA argued that a person with HIV would struggle with the various vaccinations that crew members are to receive. The court's decision was that SAA's policy for medical examinations were based on the considerations of medical safety and operational grounds. However, the court also found that, based on medical evidence, that an asymptomatic person living with HIV would be able to perform the duties and responsibilities of crew members. Any risk to passengers or third parties were insignificant with regards to asymptomatic HIV-positive people. The court highlighted that SAA's actions of only testing applicants for the position and not existing employees was in fact conflicting. The Constitutional Court favoured the appellant as his right to equality was violated. I will now hand over to Caitlin, who will speak about whether the issue of the case study worked or not.
As mentioned by Megan, I'll be speaking about the Hoffman v. South African Airways 2001 case and how it brought about the unfair act of denying a job opportunity to an individual due to the infection of HIV/AIDS. SAA's reason for denying the individual the job opportunity was owing to the fact that they had HIV/AIDS and were required to travel worldwide while being able to receive certain vaccinations against numerous illnesses, which individuals who have HIV/AIDS may not receive. Although the High Court agreed with SAA's decision, saying that it was based on operational grounds and medical safety, when it was referred to the Constitutional Court, they found the following. Firstly, an asymptomatic person with HIV/AIDS could still perform the work duties of a cabin crew member. Secondly, any hazards to which an immune-competent cabin member may be exposed to can be handled through appropriate counselling, monitoring, vaccination, and the administration of the appropriate antibiotic prophylaxis. Through thorough precautions can be implemented to prevent any risk to passengers. SAA were not testing current employees against HIV/AIDS. The Constitutional Court therefore was in favour of the job applicant in saying that by denying him the job position, it violated his rights to equality as stated in Section 9 of the Constitution. I will now hand over to Caela, who will be presenting on Anke's part about the return on investment of such.
As Caitlin said, I will be addressing Anke's part about the return on investment. Return on investment is a performance measure used to evaluate the efficiency of an investment or compare the efficiency of several different investments. Productivity accelerates economic development, and this improves the standard of living and the quality of life of people. It is important for SAA to implement the correct policies and procedures that will assist employees with HIV and other infectious diseases and place effective HIV preventative strategies and AIDS treatment initiatives. If an HIV-positive employee feels valued and supported by the company, their productivity will indicate a significant increase. Ultimately, if their labour productivity and morality increases, then absenteeism will decrease. Higher productivity of employees will generate more income for SAA that leads to the efficient use of their resources and contributes positively to sustainable development. As a result, loss of investment will be minimized. Thus, the more the company chooses to invest in the employees, the more they will receive out of the employees, and the return on investment will be highly beneficial to the organization. Caitlin will now address Anke's part with regards to how they can adequately and effectively manage the issues in the case study.